everyone, and welcome back to another episode of ABH Making a Difference in Mental Health. I'm your host, Danielle Young, and we just completed our Men's Mental Health Awareness Month for the month of June, and we had such great discussions. We had discussions about Black men and mental health, and we also had a really great panel discussion about fathers and fatherhood and the impact that it has on some of the panelists' lives. But today, we are in a new series. This starts July, the month of self-care. And we have a very special guest with us today who will be talking about self-care from a very interesting perspective. We have Dr. Leslie Baugh, ABH's Medical Director, who will be discussing self-care from a psychiatric and clinical perspective. But before we get to Dr. Baugh, I want to say hi to my co-host. Hey, Wendy, how you doing?
Hey, Danielle, how are you? I'm doing great. I'm so excited about today's conversation. And you know, you and I love self-care. And I'd like to welcome Dr. Leslie Baugh.
Thank you both so much for having me. It is a pleasure to be here. I am the ABH Medical Director, and I've been in the Maryland area practicing now for about 25 years. You know, I think that the topic of self-care is essential, and I really want to take the opportunity to share a little bit of information. Psychiatry on a whole is a very unique medical specialty. It has a very holistic approach to care, so it's combining the biological aspects like genetics, biochemistry, along with the social, emotional, and behavioral aspect of an individual. So it's definitely a personal state of well-being that we like to focus on. You know, particularly in the time of COVID, I think that this is a wonderful opportunity to talk about self-care. I think a lot of folks have found themselves isolated, increased depression, anxiety that they didn't anticipate, and wondering how they can access care. Where does one even begin? And that is where the opportunity to discuss what psychiatric care is about and what it can do for you. A lot of people, there's a lot of stigma associated with mental health. And I think in terms of sustaining, achieving, and maintaining, I think the ability to support individuals so that they are able to thrive, I think of the ability to achieve your personal best. And I think about providing skills for those so that they can independently move forward and thrive.
Dr. Baugh, thank you. I love the perspective that you brought in terms of explaining to our audience that, yes, psychiatric services is a part of self-care because it takes a holistic view at the person and wanting the person to be able to thrive and be their best.
Absolutely. And thank you again, Dr. Baugh, for breaking that down. You know, I have a question for you. You know, we really want to know here, how does psychiatry and therapy work together? You gave such a great explanation, but can you break it down for those of our listeners who really want to know a little bit more about how can psychiatry and therapy work together? And then could you make the comparison between mental health and medical health for those who are, you know, wondering, what does this mean in layman's terms?
That is a fabulous question. And I think that definitely a topic that is needing some elaboration. You know, psychiatry and therapy go hand in hand. You cannot have one without the other. You know, and as a matter of fact, psychiatry has been practiced since the 1700s, right? And its main focus has always been psychotherapy. I think as the years have gone by, the scientific basis of psychiatry has grown exponentially. So too has the therapeutic intervention. And individuals are able to benefit greatly from the expertise of both the psychiatrist and the therapist. I think at some point when psychiatrists were doing both, that was feasible. But as things have become more complex, being able to give the time to the individual is where the focus is. And, you know, we know that psychiatry is a biopsychosocial model, you know, and it takes a team. So collaborative work is really the key to treating individuals.
Mm-hmm. And if I could just add, it's very interesting that you say that, and I would also say that it's very necessary, considering that I myself, as a therapist here at ABH, it is very necessary for clients that I work with, if they are under medication management, to have that team effort, the collaborative team effort that you speak of. And so, I would love for our listeners to understand that too, that sometimes you can't have one without the other, and they're both beneficial to each other. Yeah.
Absolutely. I think, when we talk about mental health, and, when you mention medical health, or I call physical health, I think that it's important to note that they too are really intertwined. I think because physical and mental health are still part of under the umbrella of medical care, it's important to note that in terms of similarity, you still have a very diagnostic approach where you gather history and where you have a differential diagnosis where you determine and rule out the possible things that could be the source of the problem. By and large, I think it diverges when you begin to realize that it takes a village. It's going to be therapist and the physician gathering information from every facet of that individual's life, right? Schools, other doctors, churches, colleagues, and of course, family members. It is impossible to comprehend until you realize how much of a teamwork approach is necessary for treatment. I think that in large part, again, collaborative care is going to be the key to this approach. And, I do think that the best practices approach is what's shared both in the medical realm and in the therapeutic realm, so that you are using research, clinical expertise, community practice to determine the intervention that's going to fit for your particular individual.
Absolutely. I love the conversation about how this is teamwork and collaboration necessary to help our clients. Dr. Baugh, so as we continue to explore self-care and medication, what are the top 5 myths that you'd like to dispel about taking medication for psychiatric issues?
Just a wonderful question. I could go on and on about this. And if you only want 5, I'll give you 5. But I would say first and foremost, I think the most common concept is that medication won't work, that this is not a biological illness, but that this is character weakness, mental weakness. Number 2, I would say medication leads to addiction. I think that this, just the other day, I had a conversation with a professional about just that somehow starting psychiatric medications will be a gateway to illegal substances or dependence on medications of all sorts. Number 3, if I take medication, it's going to change my personality, who I am. It's going to make me a zombie. And quite honestly, nothing else could be further from the truth. What we are focusing on is for you to be the best version of yourself. And I think number 4, once I start the medicine and I feel better, I can stop it. I'm not going to need it.
That is a big one.
That's a big one. That's a big one.
Or, hey, I'd like to get off my medications and maybe just do that on a as needed basis. Definitely a common concept. And number 5, once I start medication, I'm always going to need to continue taking medication. This is something I have to commit to for the rest of my life. And that is absolutely something that I think is terrifying for folks. And I think being able to understand that all for one and one for all, that's not the formula. I have a lot of experience in which patients will often say that they have a friend or they have a family member and they've been using a certain medication and wow, they're transformed. It works for them. And sometimes, they'll be talking about an antidepressant for depression in relation to how that's going to work for their bipolar disorder, their schizophrenia, their ADHD. And so I often say, well, the positive takeaway from this is that you have seen positive responses when medication has been used. But the important takeaway is to know that every treatment choice that we make when it comes to medication is specific to your symptoms, your body, and your goals. And so I really want to reinforce that concept with medicine, that not every medicine is for everyone, and we try to streamline it to meet your needs. There are some people who may need to utilize some form of medicine for a while, but then there are many people who, once they've stabilized, are going to be able to move forward using, as we were talking about before, using the coping skills that they've gathered from therapy and discussions with the professionals. So, I think it is important for people to know that this is a stepping stone to thriving.
Right. Dr. Baugh, I love the fact that you brought up the very first myth, which is, I don't need medicine. That means if I take it, I'm a weak person or something's flawed in my character. How do you get patients to move away from that thought?
That's a marvelous question. I think one of the most important things, and even when I am training other professionals, I really like to focus on your initial contact with people is just letting them know about you in terms of who you are and what you can offer. That there is no contract that you're signing committing them to treatment, and that this is a biological process. I think for some people, when they learn and understand that there are actual genetics and biochemistry involved, it allows them to understand this in the perspective of having high blood pressure, having diabetes, that we are treating a process. And even though you don't diagnose someone by, hey, that medicine works for you, right? It is still important for them to know that taking something and then seeing benefit from it is a good indicator that there may be a biochemical process taking place. And leaving that open. I think providing the information, allowing that to marinate a little bit, and for people to really think it through. What's the worst case scenario? It doesn't work. The best case scenario is that I'm feeling the best I have in years or in my lifetime. So that's what we want to do, is provide them the information.
Great. Thank you for that.
You're
How
welcome.
about you, Danielle? Anything comes to mind?
Yes, as Dr. Baugh was speaking about some of the myths that she mentioned in the latter portion about either once I take it, I can't stop, or once I take it and I feel better, I'll stop. I experience a lot of that with clients, specifically my clients that are diagnosed with ADHD. And, sometimes we have challenges with making sure that you take the medication as prescribed on your schedule. Just because you feel great now doesn't mean that you stop, because what happens is I feel like, especially with my young ones, the symptoms come back, but they're like times 10. And of course, this is not mathematically correct, or, this is not correct, but it feels like that. So when I am in session, the processing or having to honestly get on parents or get on my young teenagers who are adults, so my 18-year-olds or my 19-year-olds that have been diagnosed with ADHD or other attention deficit challenges that have medication prescribed to them, it's really like getting on them and making sure that, listen, you're prescribed this for a specific reason. And I like that you brought up the point that if the medication is working, and hopefully I'm saying this right, that there is a biochemical connection to the progress that you're making with the medication that you incorporate into your daily life for appropriate functioning. So hopefully I said that correctly, but I definitely identify with that. And I'm thinking of just little young ones bopping up and down on their virtual classroom because they're not taking their medication just because you're at home. But that's another thing too. With COVID, there have been just so many different challenges with medication that just because you're home doesn't mean you have to take it, but you still have to do the same daily routine of going to school virtually, yes, but you still have to take these things. So I definitely identify with that, but I love the fact that you said that if it is working, then there definitely is a biochemical or biomedical connection. So that would be my thoughts about that.
Mm-hmm. And that's wonderful. And, bringing up so many different aspects. And I think it's rich for people to know that medication doesn't always have to be forever. And ADHD in particular is very interesting because that actually is very unique in that for young people especially that have come to the office and they haven't initiated their own treatment, right? Very often parents are bringing young people into your office. They haven't come on their own. So it's a double whammy. You have to sort of convince them, because I am a big advocate that no matter what your age, taking medication has to be an investment for everyone. And that includes the young people when they come in. So I will often know that I like to have a little cushion, a little buffer, so that we aren't necessarily starting medicine on the day that you come into my office. Talking about it, explaining, and then coming back and reviewing and asking, hey, since our last conversation, what did you get out of that? What do you think?
Right.
And, particularly during the time of COVID, if parents are not convinced, they only have to be in the living room or the dining room or the kitchen or the bedroom 24/7, trying to keep their young one on the computer to know that there's a process here. What do we need to do to help my child thrive? And it doesn't have to be every day. For some medications, you really can adjust it and personalize it to the needs. And that gets a little complicated because obviously there are other medicines that are far from the truth. That even when you are not in the classroom, or you are, not at work, there are some medications that you're going to need to take on a routine basis so that you can maintain a steady blood level, and so that it is effective all the time. So that the breaks in taking the medicine won't work as well because you won't have those levels in your body. But the other thing I say when adults and or young people say, well, listen, I'd like to see what it's like off medicine, or, can I maintain now that I'm doing so well? And my first response is always absolutely. And let's do that together in a very graduated way, right? So that rather than an all or none, you say, we're going to lower the dose. Let's see how you're feeling. And I can assure you, for the large majority of people, when they, especially prematurely, decide to lower or stop, will come right back to the office and say, that's not going to work. I think I now understand that this might be happening. So sometimes you have to let nature take its course, because I think that you get the greatest commitment and investment when everybody's on the same page with the medication. Absolutely.
Thank you for that. I think my takeaway is that when someone in the family needs to be on medication, that it's good to have family support. And also, it's also a good thing to know that stopping and starting and taking your medication inconsistently can have a negative effect on your recovery. So those are two great points, Dr. Baugh, that you made.
Thank you.
Now, Dr. Baugh, before we go, we have a burning question for you. We want to know, what do you specifically do for self-care?
I can say that this was probably the easiest and the hardest question out of all of them, because at first glance, I would have said, I don't know that I have a lot of self-care interventions for myself. And then I really thought about it, and I was like, well, the beauty of this is it's a little simpler than I thought. And that's a wonderful thing, because I think that if self-care, it's like makeup. If it's a whole lot of trouble, let's forget about it. Okay? So
Love it.
Say, the thing that I think has been very helpful for me would be, first, from the emotional perspective, connecting with my loved ones, connecting with friends, and surrounding myself in a positive environment. And you know what? That can be an everyday thing. Because if you know that, there's a drop dead time, and then at 9 o'clock, everything goes off, and I'm just hanging out. I'm watching, random TV. I'm just chatting and laughing, and I'm running around, again, having my older kids at home during the time of the pandemic has been wonderful. So I'm just like knocking on the door. Hey, what's going on? Here I am. I think another aspect has been my spiritual self, personal faith. And I incorporate meditation wholly. And I think that, if it's one thing that I've noticed that I talk about more over the years than I did 20 years ago, that would be part of it, is incorporate your personal spiritual thoughts along with meditation. It is definitely an ability to connect with yourself. And the physical. We won't talk about going to the gym and exercising, but we will talk about movement. I think that if every day you can just get your heart rate going, that is a wonderful opportunity. And, there are enough articles to tell you that you will read articles that say you only need 5 minutes, 10 minutes, 15 minutes. So take it. Take every minute that you can. And if it's dancing to music, running in place, but take the opportunity to sort of get your energy up every single day. And I would say challenging myself. One way or another, do something that's either totally new to you, that you haven't done in a long time. Get out of your comfort zone. Mentally, cognitively, really important. And for me, that would be crossword puzzles, reading when you can. But these days, with a smartphone, again, 5 minutes of crosswords, easy. Word find, easy. But super important, I think, for the long term. And the most important is develop and find your personal mantra, something that you just hold strongly to for yourself and live by it. For me, it's never make a decision out of fear. If I fear something, that means I probably should do it. And so I would have to say that those are core pieces in thriving. Those are core pieces in being your personal best. And that's really what self-care is about.
All right, ladies and gentlemen, so you heard it here first. Dr. Baugh's self-care methods include emotional methods of spending time with your family, binge watching your favorite television show from a spiritual perspective, meditating, and then also doing something that is new. Get out of your comfort zone, find your perfect mantra, and don't act out of fear, but go for it. Be confident and be courageous. Dr. Baugh, thank you so much for all that you've offered to our listeners for today. I have just been thoroughly educated on the areas of self-care and the perspective of clinical and psychiatric care for self-care. So thank you so much for providing us with such educational gems. Wendy, what are your thoughts before we close out?
I think it's been a wonderful conversation. I hope our listeners walk away with some knowledge and that they're not fearful of medication in psychiatry and have a better understanding of how therapy and medication work. And I love the fact that Dr. Baugh said movement. How important is movement? Because our next guest coming up is a movement specialist. So yay for that. So self-care, everyone, wonderful. So I thoroughly enjoyed this conversation. And Dr. Baugh, we would love to have you back and highlight some more information. I know you have a lot to offer around ADHD, and that's something that we can plan in the future.
And thank you both so much. This is a pleasure, and I love what you're doing. And speaking of outside my comfort zone, here we are. So I just want to say it is a pleasure. You all have made this very enjoyable. And I hope to chat and talk some more with you. Have a wonderful day.
Thank you so much. So keep in mind, we may have some mental health moments from Dr. Baugh in future podcasts. Ladies and gentlemen, that is the end of our podcast. But be sure to tune in next week as we talk about self-care and motion. I am your host, Danielle Young, with Wendy Grier. We are striving to make a difference in mental health. We will see you next time.